Good afternoon, everyone, and thanks so much for joining us today. As Tim mentioned, my name is Ryan Hamachek. I do work here at Seattle University as the Director of Wellness and Health Promotion. In the work that we do in the department, we really focus on a variety of things. Our main areas of focus are physical wellness, mental health, alcohol and other drugs, and healthy relationships. So we tend to be the department here on campus that is working to kind of proactively and preventatively address some of the things we anticipate a number of our students will experience as they are here at Seattle University. Specifically, our time together today is going to focus on student illness, stress that our students are experiencing, and then we're going to take a little bit of a glance at what's going on campus related to alcohol and then marijuana, especially in light of recent changes in the state of Washington toward legalization of recreational use. So that's where we're going today. If that's what you thought you signed up for, you're in the right place. Really quickly, I just want to set the stage by talking about some things that most students are experiencing as they are here at school, and particularly as our students are coming in that first term here at Seattle University. They refer to it as adulting. And that's really any time that they're doing something that previously they saw people older than themselves doing, and they now start doing for themselves. Things like the laundry, or kind of writing holiday cards, right? Things like that are examples that come up for our students. But really what they're doing as they're doing this thing that they call adulting is they're really working on developing competence. Certainly they're doing that academically in their coursework. Developing concrete skill sets there. But they are also developing competence as individuals, right? As people who are becoming ready to live independently in society. And so much of the work that we do in the Division of Student Development really is around this competence development. Our students are also working to learn how to manage emotions in really great and healthy ways. Certainly, it's been an emotional quarter for many of them. I'll talk a little bit about that in just a moment. But really, what they're working to do is navigate those emotions in the context of community, and some of the work that we do is really about helping them do so in ways that are really healthy and engaged. I was meeting with a student not too long ago. And he came in and he was like, I've just been really bummed out for about the last week, and I can't figure out what's wrong with me. And and he was kind of going on and on about this, and I looked at the student and I was like, maybe you're just having a down and out week, and that's okay. And in that moment, he had this kind of look of relief on his face. He was like, wow, I just get to be down and out, and that's all right. So we had a great conversation about how experiencing a full range of emotions is actually a really healthy sign. So our students are working on that as well, and then ultimately. What they're working on, at this kind of point in the game as they're kind of starting their years, is really trying to figure out how do I exist not only as an individual and doing the things that I want to do, but interdependently within a community. So this comes into play a lot in our residence halls, right? So certainly I have needs to play music or wants to play music late at night, but now when I'm living in close proximity to so many people, there's a community impact there. So how do I engage actively in my courses in ways that are respectful to everyone else who happens to be present? So these are some of the things that we're working with all of our students on. And then ultimately, in terms of their kind of intellectual development here on campus, they really are in the process of moving from dualism, which is really that black and white thinking, right and wrong, looking to authority figures for answers, towards what we call multiplicity. So this idea that there could possibly be multiple right answers, and what that means. So much of what we tend to do with our students here on campus is when they are looking for an answer, we ask them what they think, which to them sometimes can be a little maddening. But if they're saying, well, I don't know what to do next, my question to them is often, well, what do you think the best next step would be. So encouraging them to really find kind of their own autonomy in that decision-making process really helps them kind of incrementally practice developing that competence that we're trying to engage here on campus. So that's kind of the baseline of what we know some of our students are experiencing in terms of their development here on campus. Certainly, there is kind of a broader context. We are kind of living through this community kind of post a particularly ugly election cycle, and so I think for our students, stakes feel very high right now, regardless of who they voted for or who their families voted for. There are great conversations happening, and in many ways great debates happening about what's going on in the future. Our students are kind of actively talking about what's going on with the Access Pipeline project. Black Lives Matter continues to be a mobilization effort that's very present on campus in very life-giving ways to our students. And then we're continuing conversations on campus about some unionization things. I think the image on the screen for me really demonstrates how I experience our students here on campus. They really do fight because they love. Every time students are engaged in activism or protest or things like that, it's because they are passionate about what SU stands for. It's because they are passionate about the world that they want to create, and they are beginning to see their place in the creation of that. So I just wanted to take a moment to really kind of offer some context for both our students individually and then kind of more kind of globally what we're experiencing or feeling here at Seattle University. Yeah, I think that's probably about good there. In terms of health, so working to kind of shift gears a little bit, most of our students, the vast majority of our students, are describing their health as excellent, very good, or good here on campus. Not surprisingly, they still don't eat their fruits and vegetables. Our students report actually only having about 1 or 2 servings of fruits and vegetables a day. So we are constantly looking for ways to entice them to eat those Brussels sprouts as a department here on campus, trying to hopefully continue the work that was started at home. Some of the topics that we're talking about today include cold and flu, as well as the prevention of that. And one of the reasons is because very specifically, illness is one of our top academic impediments for our students. So it's one of the things that they report very frequently, impacting their ability to make it to class, not surprisingly, or subsequently impacting a grade. On either an assignment or in a course. So for our students, illness is a pretty big thing. And in many ways, in coming to college, this is the first time they've needed to navigate illness solo. And so they really are kind of working to develop that competence in just how do I navigate being sick and having responsibilities. So some of the things that we are doing here on campus is our health and wellness crew, which is a group of student leaders, held a vaccination campaign earlier in the academic year, trying to let students know that the flu vaccines were available, and talking to students specifically about why getting vaccinated can be really helpful for them, and then also kind of looking more broadly at the community impact of herd immunity. So we do have some students on campus, as every campus would, who just aren't medically able to get the vaccine, and we talked a little, our students talk to each other about the importance of vaccination in that way. Just so that you know, flu shots are available here at our Student Health Center if your student hasn't gotten that yet. And then most insurance providers will provide those at no cost. So this could be a great to-do list item over the winter break for your student, would be to go ahead and get that seasonal flu shot. As they return back to us for winter quarter, our department will also have flu kits available, which include things like thermometers that help them figure out whether or not what they have is just a simple cold, or maybe something more. A couple of things that we spend a lot of our time doing with our students is talking to them about their insurance consulting nurse line. So often students can't necessarily pop in after hours to our student health center, or get an appointment same day. And if that's the case, what we try to do is actually teach them about a number of the resources that they already have access to, but for some of them, they haven't used previously. And so insurance consulting, nurses are one of the things that we talk often with our students about. The other thing that we tend to do here on campus with our students as they come in to talk about illness is talking about the emergency room versus urgent care versus, say, our student health center or a primary care physician. So often they think that if it's after 5 o'clock, that the emergency room is their only option. So we really try to kind of talk them away from that if really what they're looking to have addressed is a sore throat that they've maybe had for a couple of weeks, but certainly isn't necessarily something that they would need to see an emergency room doctor for. So again, having those conversations with your students about some of these different options or ways that you've used these options as family members in the past can be really helpful in helping them, again, navigate some of these things while they're away from home. A couple of just tips how you can help us or encourage the same messages that we're encouraging. If you're talking with your student and they're saying that they're sick, do encourage them to rest. They always have a lot to do. That's just kind of a given here on campus, whether that's academically or the organizations that they're involved in or other things that are keeping them busy. But the more you can encourage some downtime, so often that's really all they need to get through their illness. It's a little bit more difficult than just taking some time away from school as it maybe was before they came to SU. Take some time as a family, maybe over break, to explore urgent care clinics that accept your personal insurance, and have them jot down some examples or phone numbers or locations for those. Some examples that we tend to refer to pretty frequently here are these two. So Immediate Clinic and Zoom Care are both available right down the street. These are our referrals when our student health center is closed or they don't necessarily have an appointment in the time that a student would need to get care. So certainly for those who have group health insurance, which is pretty popular here in Seattle, group health has their own urgent care clinic. But making sure that your student knows where the kind of quote unquote their urgent care clinic is, and that they could seek care after hours can be really helpful for our students. Next, the other thing, I reached out to our student health center and I said, what would be helpful for our parents and family members to know as I'm chatting with folks? And they said, just encourage that students have hard copies of insurance cards. So if those haven't been requested or your student doesn't have one of those that they're carrying, maybe take some time over the break to kind of help them through making a call to the insurance company and requesting a copy of that card. And then finally, if you're just looking to offer a little bit of love from home, Bon Appetit on campus here offers Get Well care packages. They include things like soup and crackers and Sprite. They'll send your student tissues and hand sanitizer, and they'll hand deliver those to the student's residence hall. And so they'll be able to do that for you. You just go to the website that's listed there, su.cafebonappetit.com, and it's under the Thinking of You section. Is a way that you could support your student. Certainly, if they happen to be ill right now or as they experience an illness moving forward here on campus. The next thing I want to touch base about is stress. So speaking of academic impediments, our students say that stress is the #1 thing that impedes their ability to be successful here on campus. And so we are constantly working with them on ways to reduce or prevent stress to begin with. The good news is that about 78% of our students, the vast majority, want to know more about stress reduction. This is not the hard sell for us, whereas some of the other things that we tend to talk to students about are a little bit more difficult to get their attention on. Some key messages that we try to move forward with our students are that stress can be good. We really try to let them know that stress is part of kind of the healthy cycle of life, but it's when that stress becomes overwhelming or debilitating that we really want to work to address it. But a little bit of healthy stress heading into finals week really can motivate someone to get that studying done that they need to do to get that grade that they've set for themselves as a goal. The other thing that we tend to work with our students on is helping them differentiate a little bit between stress and anxiety. So we do that in a number of ways. Again, our student health and wellness crew here on campus will sit down with students individually and talk with them about what's going on and help them create customized plans for things. But when students are talking about things that are making them anxious or they're not able to really kind of lead the lives that they would want to lead, we start to talk about, I wonder if this has anything to do with anxiety. And there are some resources that we have for students around just some screenings. These aren't diagnostic screenings, but if your student comes home and is talking about really having a hard time with stress or being really anxious about this, that, or the other thing, encouraging them to complete one of these screenings can be really helpful in guiding them toward next steps. The outcomes of the screenings can be simple things like, nope, it looks like you're good, or actually maybe it would be a helpful thing for you to do to schedule a meeting with our counseling and psychological services here on campus to be evaluated for potential anxiety disorder. So those are some things that we will constantly be referring our students to that they can take a glance at for themselves. If you have students who are coming home saying that they had a pretty stressful term, remind them of our groups through counseling and psychological services. We offer a mindfulness group and an anxiety busters group, along with a number of other offerings that are available each term. And so those groups are kind of built each quarter and then run based on student needs by our psychologists or mental health professionals in counseling and psychological services. I mentioned a little bit earlier the work that our health and wellness crew does, so I will let that stand. But a key message that they tend to take forward is really one of mindfulness, encouraging our students to practice that, whether that's through breathing mindfulness, something as simple as taking a few minutes before getting into homework, or something more formal, meditation. We offer spiritually based meditations here on campus, but also fitness-based meditations that really are engaging people in a variety of different mindfulness practices based on what they are looking for. This stuff tends to be easier said than done for our students, because when they are at their most stressed, they're least likely to actually be heading to our fitness center or adding something to their schedules. So we try to talk about the value there. As we're talking with you right now, hundreds of students are lying on the ground, hanging out with dogs, just like in the photo. Here on campus. So De-Stress with Dogs is underway, and we also offer weekly massage here on campus. This isn't something that's included. I'll talk a little bit more about how, if you're looking for a nice small gift over the holiday season to offer your student, a massage gift certificate might be nice. But it is something that we offer, knowing the stress-related benefits to regular massage. Our fitness center, including classes like yoga and all of our other fitness classes, are included in your students' tuition and fees. I know in preparing for our time together today, a number of you were asking, how do I encourage my student to get more involved in their physical fitness? Certainly just encouraging them to get to the fitness center is a great first step. They can take tours at the front desk and things like that. We'll talk a little bit more about that in just a moment. And then the other thing to encourage your student to take a look at is the 2017 Wellness Challenge, which will be coming up in January here. It's a team-based challenge. There's no cost for students to sign up for this, but they can sign up with 4 of their friends. Registration will go live actually this week, not necessarily thinking that we're catching a whole lot of students just before finals, but oftentimes over break is when they start to think about, all right, what are some changes I want to make for next term? And we really use the Wellness Challenge as an opportunity for them to set some personal goals and kickstart the year in ways that are a little bit more healthy. than the last. And again, some of you had some questions about the kind of the gloom of Seattle in the rainy winter months. Hopefully you're happy to hear that we have happy lamps in our office, and so students can pop into wellness and health promotion, which is on the 3rd floor of the student center, bring their breakfast in the morning, sit down for about 20 minutes in front of a happy lamp, eat their breakfast or work on a paper or do some reading for class, and those tend to be a really nice full spectrum lamps that are opportunities for students to kind of help beat that the gloomy winter months. These happy lamps also tend to make a really nice holiday gift if you've got some students who are a little bit worried about what the winter quarter has to bring. And then I'm seeing a question that came in here. It says, for those not in the 95% of good health who are struggling with unexpected physical health issues longer than expected, what services or resources are triggered, particularly for those who require healthcare advocacy? And examples were offered related to transportation, accompanying to doctors or assistance with calling doctors' offices or follow-ups. I would say certainly that would be something that our office would be able to assist a student with. So having them pop in to speak with me, again, in wellness and health promotion, or if they're interested in chatting with a student, it would be those students on the health and wellness crew. Really, we can talk to your student about a specific circumstance that they're experiencing and then do some troubleshooting for them here on campus. Sometimes, especially when a student is experiencing that long-term health issue, the systems can be really complex and confusing. And what we see our role as here on campus is doing what we can to help coordinate those for students. Certainly, public safety would offer transportation more so in kind of one-off instances, but we could talk with your student about some of the transportation options that exist already on campus, like the Redhawk, and we could talk to them about, does your doctor offer appointments during the hours that those things run? Really just kind of helping them think through the full flow of resources that they have access to already. Otherwise, discussing with them options like car services or things like that. And again, we've got some relationships with local car services here on campus. Like Lyft, for example, is one that our students use quite frequently. But in terms of calling doctor's office for follow-ups and things like that, that would be one of those things that we work with a student to really empower them on, and helping them kind of maybe identify some key questions that they might want to ask, but really we'd leave that doctor's office follow-up to them. So lots of ways that we're just working to support students really kind of in any of their kind of unique individual needs. So I'm going to kind of finish up with stress here pretty quickly. As you're having time over break, really just encouraging conversations. But if you ask your student, was it a stressful quarter? They might likely say yes and leave it at that. We just encourage you to dig a little bit deeper, asking them questions like, what was the most stressful part of the quarter for you? What worked well to help you relieve stress? How could you set yourself up to do that more frequently as you head into this next quarter? So really encouraging those conversations over break. And we can't stress enough the messages around sleeping well and eating well. Again, they tend to be challenges for our busy students. And certainly as they're home for break, they might sleep a lot. They've got a little bit of catching up to do. But asking them questions about how are you going to get more sleep while you're back for winter quarter can be a really helpful question to be asking. I mentioned earlier massage gift cards. Those are available. Some information about how to get those by calling our service provider directly are available on our website here, seattleu.edu/wellness/massage. That would be, kind of a great little gift for students. Again, Bon Appetit offers an exam cram care pack. So if you're thinking to yourself right now, how can I help my student reduce their stress a little bit while they are just getting ready for exams? You could give Bon Appetit a call today, and they could make sure that that care package gets to your student by the time they are well into finals, even just next week. And then finally, one of the things that your students might not know about and might be worth talking to your student about if they're interested in engaging in more physical fitness is that the university does offer personal training and buddy training. These are two services that aren't included in tuition and fees, but again, if you're looking to for holiday gift ideas, or you know it's something that your student is interested in, but financially, it's been a challenge before. Taking a look at the university recreation website to learn a little bit about what we have to offer around personal training can be helpful. And the buddy training is just basically where your student would maybe find a friend that they have, and they do some personal training together with some similar fitness goals. So ultimately, the goal there is to help maintain motivation for everybody involved. So before I move on to our next topic, which is alcohol, I just want to pause really quickly for any additional questions that you might have around illness or stress. Um, you can just type those into the chat box. Okay. Well, if those come in, we will. I'll circle back to those at the end, but otherwise, I'll keep us moving forward. All right, so I want to touch base really quickly on two substances that when we think about stress and our students, they sometimes turn to with a little bit of information and then a little bit of how you can help, kind of echoing the messages that we've got here on campus. Important to share with you is about 16% of our students have never had anything to drink. That's down a little bit from the last 2 years, but we will be redoing our study in the next couple of, or I'm sorry, our study in January, and so we'll see if that number was down just a little bit as as an anomaly, or if that tends to be a trend for us. What we know is that about 70% of our students had something to drink within the last month, and that about 70% had 5 or fewer drinks the last time they partied. And so the good news is that our students who are choosing to drink, by and large, tend to do so very responsibly. The messaging out of our office really tends to be that harm reduction approach. How do we make more responsible choices around alcohol? And then we constantly are talking to our students about ways to reduce their risk. 99% of our students identify having engaged some level of risk reduction. Most common is the use of a DD or sober transportation. Your students are getting messaging from us kind of at all angles related to alcohol, everything from orientation to our policies on campus, like Redhawk's Care, which is an amnesty policy encouraging students to call for help if they're ever concerned for a friend. The track class here is a not so optional opportunity with us for students who have been found responsible for a violation of university policy. But it tends to get really great reviews from our students. And then I work directly with our students who are sober and in recovery as well. So really kind of thinking about alcohol from a broad perspective, and really kind of engaging our the most research-based strategies. So speaking of research, there's some great information about specifically parents' role in communicating alcohol, and I'm going to go through these somewhat quickly. Certainly the intention is not to tell you specifically what to do, but to kind of point out some really great research that's out there about how parents impact their students' use of alcohol. Specifically, some of these points are coming from a website called collegeparentsmatter.org, which came out of a collective of researchers in Maryland. We have a similar collective here in Washington State, and we do very similar work, but thought that these folks had pulled together a really helpful resource and wanted to share that with you today. Not surprisingly, parents are one of the biggest sources of influence. The best predictor of how much a student is going to drink in college is actually how much they were drinking during high school. And so if your student was drinking already in high school, chances are that that pattern continued. And so we'll talk a little bit more about some opportunities for conversation there. If you drink personally, certainly encouraging modeling responsible use is important. Your actions speak volumes to your students. And then the one thing that I think is really interesting is that the popular misconception that turning alcohol into some sort of forbidden fruit makes students kind of go wild when they get to college is largely inaccurate based on the research. What we actually know is that parents who give their adolescents opportunities to practice responsible drinking do set them up for more problems. So what we tend to see is increased use in college, increased consequences based on that use. And so just sharing this information so that you've got it as you consider expectations as your student might return home over the holidays, and as you're working to kind of establish that. A couple of things that we're learning through the research around key communication from parents and how that's important is, and this is maybe different than what we've thought, but that zero tolerance messages really appear to be the most effective against alcohol use and its related consequences. And that could be everything from missed classes due to hangover or kind of situations that would involve law enforcement. So consequences is kind of broadly defined. And so the piece here would be to consider how, if at all, a zero tolerance message could fit into your family life. If your student is drinking or has shared with you that they're drinking, are there opportunities to say while they're home over break, you have expectations that they wouldn't be doing that in the home or things like that. Certainly those are your choices, but these are the things that the research is showing are pretty effective. And conversely, parents teaching their students how to drink and the likelihood of harm if drinking occurs was found to be associated with higher levels of high-risk behavior. So that includes amounts consumed away from home and things like that. So certainly happy to answer questions about that. But what we try to do ultimately is stay up on the latest research related to alcohol, knowing that it does have impacts on our students' academic success. So a couple of notes about how you can help. Just know that drinking does peak over winter break, only second to spring break. So even more so than when students came to school here. Ask your student about their use. I would certainly just encourage a conversation about it. Has your use changed since going to school? Has it started since going to school? And that website I mentioned earlier, collegeparentsmatter.org, has a variety of really helpful conversation starters and specific sentences. They've got a ask this, not this section, which can be really helpful if you're wondering where to start with that conversation. And then the only other thing that I'll offer is just an encouragement to really support the campus conduct process. If your student happens to call home because they've been involved in the campus conduct process, oftentimes they'll end up chatting with me. And so often when I ask them, what did your family say about when you shared this with them, they'll say, oh, they said to be safe, it's really not a big deal. And just to encourage you to do what you can to really support that process can be really helpful, and certainly happy to chat with parents individually if the need arises. A couple of other resources to share with you is that we do offer an online basically wellness checkup for your student around alcohol. So if they're wondering how they're doing or you want to have a more in-depth conversation, asking them to kind of complete this, it gives them some personalized feedback and ideas for potential change moving forward. So I tend to use this as I'm meeting with students, but you could certainly do that as a family member. If you're actually worried about alcohol use disorder, again, one of those mental health screenings is available for our students and might be a helpful first step. And again, if you have students in recovery, please direct them my way. I tend to keep a list of students on campus who are in recovery and interested in being connected to one another. Oftentimes, it's just helpful to have that community. So that's what's going on with alcohol here on campus. And trying to save the best for last, or at least kind of the most interesting and ever evolving, is marijuana and what we know is going on around marijuana. The great news is that the vast majority of the majority of our students have never used at about 54%. And only about 20% have used within the last month. This is in pretty drastic contrast to what students perceive. So when we ask students, how many of your peers do you think are using pot? on a monthly basis. They say about 90%. And so a lot of the work that we do is really to kind of bring those perceptions into alignment with reality so that they're making decisions based on what's actually going on, which we know is significantly less than they might think. And we're not that far off nationally. So even in a state where recreational marijuana has been legalized, we're only about 2 percentage points up in terms of use within the last month. And this number really has stayed pretty constant pre-legalization, so we haven't seen a significant shift post-legalization. Again, we're going to be redoing this study in winter quarter, so we'll see what if any, changes come up then. Our messaging with students tends to be really consistent. There's a lot of ever-evolving research, but the stuff that's pretty clear is where we tend to spend most of our time. Attention, concentration, and memory are things that are known to be pretty heavily impacted by marijuana use. And we talk to students a lot about how those types of things are pretty important when they're trying to get degrees here at Seattle University. So we tend to focus there. And then we also talk to them and want you to know that some newer research is indicating that use is directly correlated with missed classes, and as a result, some lower grades, and as a result, later graduation. For those who are pretty close to this research, they would say, but can't yet prove, that that relationship is causal. And the main reason is because they're seeing a rebound effect. So what we're seeing is that if our students simply limit or eliminate their use, we're seeing a rebound in missed classes, grades increasing, and then graduation timeline. So that's what we know. That's some of the latest research that we're seeing related to marijuana and its impact on our student success here on campus. I will say that, marijuana is pretty normalized here in Seattle. This is what a store looks like. And so having conversations with students about what does kind of making decisions around marijuana look like for themselves personally, while everything here is legal for folks who are 21 and older for recreational use. We do spend a lot of time at orientation talking about this, and our key messages really are about intoxicated driving. Our message there really is about encouraging our students to wait 5 hours before driving. So if you know that your student uses marijuana and is home over the holidays and might be using it at a friend's house, just really encouraging that 5-hour waiting time can be really helpful. And it definitely is, I would say, one of the more conservative numbers, but it's the best number that we have that's most inclusive at this moment. So 5 hours after use is showing to be a pretty good and safe amount of time for students to wait. We're telling our students that the pot is stronger in the legal market. So the legal market has actually resulted in a lot of innovation, not always in the best ways. It's resulting in more people doing things like dabbing and in using marijuana in very unique ways. So we're really encouraging that and just talking to our students a lot about the academic impacts and reminding them why they might be here. Again, we're social norming, which is bringing those misperceptions in alignment with reality. And I spend a lot of my time individually talking with students about some of the withdrawal symptoms of using marijuana. The two main ones are anxiety and sleep. Because oftentimes as I chat with students, they'll say, I'm choosing to use because I'm stressed or anxious, or I'm having a hard time sleeping. And so we talk a lot about the chicken or the egg is possibly the reason that you're having a hard time sleeping because you're withdrawing from a substance. And so we'll talk a little bit about what potential changes for them might look like in that moment. So really how you can help related to marijuana is just know that it's an ever evolving situation, and we are doing the best we can to stay up on all the latest research when it comes to prevention efforts here on campus, and certainly being realistic about what our students are doing or not doing. Similar to the wellness checkup that we have for alcohol, we do also have one for marijuana. So if your student is a user of marijuana, you can encourage them to go here. It might be a great way to start a conversation, asking them, was there any information that you found surprising? Can be a really great conversation. But at the end of the day, ask your student about pot. Even if they're not a marijuana user, I've got some questions on this next slide that might be helpful. Asking them if they've tried, do they use, if they're used prior to coming to SU, do they continue to use? Do your friends use is a good question, and how has that impacted your friendships? Can be really helpful in starting a conversation there. If your students say, yeah, I have used or I have smoked, asking not only they'll tend to be pretty kind of vague about it, right? Yeah, but not that much. So I tend to get pretty specific with them. Talk to me about how many days a week is not that much. Maybe it's 1 day a week for them. And more specifically, and this next question really is coming out of some of the best research, is how many times a day? Because I had a conversation with a student not too long ago, and I was like, how frequently are you smoking? He said, maybe once a week. And I said, okay, and about how many times a day are you doing that? And he said, 3 to 4. And that's a very different user than someone who's maybe smoking just once a day. Asking your student, how are they using? So unfortunately, what we're learning is that smoking it is some of the safest ways to consume it because of the reduced risk of overdosing on high levels of THC. But now there's a full edible market that's blossoming. I mentioned dabbing earlier, so we're keeping a close eye on that and educating students in regards to that. What do you like about smoking or using? This really helps you as a family member to understand what are their motivations for it to begin with, and then asking what are the not so good things, and then what have you found helps those not so good things happen less often. So that was just kind of the quick overview of what we're working on here on campus related to illness, stress, alcohol, and marijuana. I've seen a couple of questions come in as I've been talking about these latest 2 topics, so I'm going to start to address those, but would also open up for additional questions that you might have. Please feel free to write those into the chat box. I'm going to click over to our next slide and offer my contact information. I'm certainly happy to have any follow-up conversations with folks, and we will be making all of these slides available so that if you happen to have missed a website or there was a good question there that you think would work well with your student, you're able to refer back to that. The first question that we had come in was about the massage gift cards. How do we deliver massage gift cards locally if we buy them for our student? And so one of the things that you can do as you're purchasing those gift cards is what you'll do is you'll actually call Dream Clinic, which is our massage therapy provider, directly, and you'll just place that order over the phone, and then they will take an address that you want that mailed to. So if you want that mailed home to you so that you can include it in a holiday gift, excellent. Otherwise, they could mail it directly to your student. That would be perfectly fine. And then that same website where you'll find that information is where your student could find information about getting their time on campus scheduled. So that's a pretty simple either online process, or they can just pop in to the massage therapy station to check on day of availability. The next question that came in was regarding alcohol. The question was, I was surprised to hear there were a number of students who'd been drinking heavily prior to fall ball and getting sick during the event. Are these kinds of school-sanctioned events chaperoned by staff? And I will say yes, most certainly. We have that event actually comes out of a student organization called SEEK, and then the staff who oversee that organization in our Center for Student Involvement were all present at that event. And so we do kind of preemptive messaging to some of those things. I joke with our students that they're not camels, and so the idea of drinking a lot ahead of time doesn't actually bode well. So we do some kind of preventative messaging leading up to some of the events that we know students will tend to drink at. But because it is a school-sponsored event and alcohol is not permitted at the event, what we do find is that some of our students will drink maybe a little bit more heavily than usual in preparation for the event, which then leads to, it sounds like, the instances you were hearing about some kind of illness there. But yeah, we do have university staff there, and then all of the venues that those events are at, we've got contracted security, and we partner with public safety if there are ever concerns that would require kind of additional response. But yes, university staff are at all of those events. And then there was a question really quickly about, can I have access to this presentation to share with others? Absolutely. We'll make sure that you all have access to this presentation via YouTube, and that will be shared on the Parent and Family Engagement Facebook page, I would imagine, as well. So certainly thank you for being here, and I'm glad that you're interested in sharing it. Any other last-minute questions from the group? There's a question in here. Do you have any date rape preventative training for girls and boys? Yeah, that actually is a lot of the work. It's kind of the one area that we didn't focus on today, but tends to be a pretty kind of a pretty busy area that I work on out of my department. We spend a lot of time working with our students all the way from orientation kind of through the time that they graduate. There are some required elements of orientation related to sexual assault and its prevention, and then I continue to do work on a regular basis with our students through a program called Green Dot here on campus, and that is really, I think, probably to the questions point, it's a really in-depth training. I was just meeting with a student this morning. Our next one is coming up in February. We've probably got about 30 students voluntarily already interested in learning more. And the way that we actually do that is we use a nomination process and reach out to students. So we're not just getting the kind of the choir to the table when it comes to our prevention strategy, but we're really reaching out broadly on campus and trying to find students who are kind of leaders among leaders in different pockets, and inviting them to participate in some of these trainings so that we can have as broad of an impact as we can here on campus. Certainly happy to talk more about that, and that tends to be the work of our department as well. Someone else commented here, I appreciated the self-defense class that my daughter took advantage of. I hope it's taught again, and a second phase, or how to defend against assault. Yeah, absolutely. So that course actually came out of our Department of Public Safety, and we tend to work pretty closely with them on our violence prevention efforts, just looking at things from a kind of a broad perspective. So they tend to do the physical self-defense stuff. Okay, well, not seeing any more questions come in. I'll just take these last few moments to say thank you so much for investing the time today. Without question, your students' wellness is incredibly important to us. We've got a great group of students who are committed all year to promoting wellness among their peers. They're always inspiring. They literally are outside this room right now wrangling dogs, and hundreds of students just kind of doing what they can to encourage students to stay as minimally stressed during finals as possible. I thank you again for taking the time to be here. My contact information again is available, and I'm certainly happy to answer any additional questions. But with that, I will close us out for the day. Thanks so much. Here's Tim.
Well, thank you again, Ryan. Really appreciate you taking time to spend with our parents and family members here with us today. And I want to thank all of you for participating. We really appreciate your questions and your insights. And we look forward to having another one of these early in the winter quarter, possibly. But until then, we wish you all a very happy holiday season, and we will see you on the other side of the new year. Take care, everyone.